and getting ready. Setting up. Yep. So, all set. Good evening, everyone. And I hope you had a great weekend, resurrection weekend, with family. We're back. I'm Dr. Tony Okwesami, popularly known as Dr. O, a family practitioner who also treats HIV and substance use disorder, but the health officer for Prince George's County. So I'm not treating patients anymore, at least no hands-on patients anymore. So tonight we have our own very dear doctor, also family practitioner, HIV specialist, Dr. Monet Ouwinga, who is bringing to us a topic close to our hearts. HIV, women, increased numbers, why? So without much ado, I'm going to yield the floor to Dr. Ouwinga to tell us the why. And welcome everyone. The floor is yours, Doc.
Thank you. Thank you very much, Dr. O. And I am fondly known by my patients also as Dr. O. So there are the two of us here this evening. It's a pleasure to be here. I am a family practitioner by training who has the pleasure of treating patients who are living with HIV. And I am a huge, huge advocate of prevention. So a lot of my talks and my huge passion is towards the ending the epidemic for everyone, but close to my heart are people who do look like me. So the young Black and brown women, adolescents, and older women as I'm transitioning. But again, everyone. So one thing I wanted to talk, and I've been searching for a more concrete answer than just social determinants of health as to why Black women are not getting on PrEP, why our numbers are increasing at the rate that it is, and how we can stop that. What do we need to do to intervene? We know transmission amongst people who use IV drugs. We know a big part, if we get them on PrEP, that helps. But we also know a big part is the needle exchange. So that was the solution to a root problem. You know, not so much rehab, get them off, but harm reduction. In the arena of HIV, when dealing with African American women, the act is heterosexual contact. How do we harm reduce this? Where a lot of women, their only mishap is falling in love with a man who may not have prioritized his health. When we think about men, historically, when it comes to going to the doctor's office, men don't come in until something is hurting to the point that they cannot take it anymore. Something is being threatened to fall off or not work anymore. And we all adults, so we all know what that is. And, something egregious is going on, but they don't come into the hospital. So it's not so much the method of we don't know what your person is doing or we think there's some cheating going on, but a matter of this person just doesn't go to the doctor. But that's not our burden to take. In the United States, despite being only 13% of the population, we account for about 60% of the new cases. That kind of math doesn't make sense to me. And in the South, in America, I've come to, in my opinion, I've come to think the historic oppression that they have suffered where within the generations that we are in, they are able to still have someone who recalls another person in the family lineage that experienced the torture of the gynecological exams and the experimentation that went on in the South. So that I can understand is a deep-rooted mistrust in the system, especially when the stories, are still fairly fresh in history, you know. But how can we combat this? How can we improve and educate women to get them to understand that they deserve PrEP? It is not a punishment. It should not be stigmatized. It should be something that you deserve to have. And anyone who tells you that you should not, you tell them to go up the block, to go up the block and around the corner, because, that's just not for you. But how do we address this on a grander scheme?
Well, I would say, first of all, PrEP is interventions that we now have that people take to prevent HIV. And initially, when we started using PrEP, like a pill a day, it was encouraged that people who are men who have sex with men should be the ones that, we make sure that we give this to. Now the story have changed. Anyone who has sex, we believe men, women, whoever should be on PrEP. Another thing that, so we can all understand what has been said here. Another thing that Dr. Ouwinga said that is bothersome and should bother all of us, why we need answers and we should discuss this, is the fact that HIV started as a disease of men having sex with men, Caucasians, men who have sex with men. That was how it started. When Pastor Paul, before we started tonight, was was really one of the forefronters on the streets of Washington, D.C. On behalf of the health department, going after partners who they have diagnosed their partner as HIV positive, to assist to test them to make sure that if they're positive, they come to care. During those times, it was disease of Caucasian men who have sex with men. All of a sudden, the numbers change, the
The
data change,
demographics,
demographic change,
their
and
numbers are now lower than our numbers.
now it's mainly Black women are leading the race. So first of all, the question is why? There are women who are married to men, Black women married to Black men, and find out they are positive when a doctor insists the husband has to tell the wife, or there are different stories that they are positive. One of the things that we see a lot is men on the down low. I don't know if, we all understand what that means. That means men who portray themselves to be heterosexuals, that is, men who have sex with women, but, on the back end, they also have sex with men. People also who are lesbians, usually think that they cannot contract this infection, HIV, even sexually transmitted diseases, but heck no, they do. Being a lesbian is not protective. That's something we need to educate our folks on also. So, your question, Dr. Ouwinga, your question.
Why? Why are our numbers the way they are?
So you can unmute to chime in or put your, your opinion in the chat box. Dr. Paul, you are muted, sir.
Yeah, well, I wanted to chip in by saying that she already actually alluded to one of the reasons for why, which was something to do with the IV use of drugs. That's a factor. And you also mentioned another big factor, the download aspect of this that is not so prominent and profound. The download people, obviously, they do it very discreetly. And most of these people are married, and you don't even know what else they are doing outside of their marriage. And like you alluded to, some of these married men, some of them are also gay on the side, and so they are engaging with women who might not necessarily know that who might feel almost feeling secure that they are dealing with married men, but at the same token, they are also participating in other compromised activity sexually. So the IV use factor is a big factor because of some of the needle exchange that are also infected also. So that would be another factor which you already alluded to. That's what I wanted to chip in to add to whatever you already have said.
One of my thoughts, is that it's rooted in there's some kind of lack of monogamy that is accepted within our culture, where subconsciously the women, okay, it's okay if my guy, I may know he has somebody, but as long as he's not bringing her to the house, or there's a certain kind of respect amongst the disrespect, if that makes sense.
Of course.
So within that area, I think there needs to be something that also holds us accountable to get screened, because we know this, but every time you ask a Black woman, are you on PrEP? Oh, I don't need that. My man is not crazy. Oh, he knows better. Even though in the back of your mind, you know what may be going on. And it maybe it's, if I get screened, it confirms what I already know. Or and that fear is what's holding back. Maybe it's the fear of not knowing which resources are available if this does happen. Because Dr. O and I work in the same geographical area, and I hear the same stories. I have, men who have to tell their wives, that they're positive. I have women that have to tell their husbands. But there's a level of trust that we're allowing these men, because this talk is about women, but there's a level of trust that as African American women that we're giving these men that we're having sex with, that white women are not giving the men that they're having sex with. And what is the difference with their mentality than ours? That's the question. That's what I want to know.
The difference, culture, background. Culturally, our generations before us accept the behavior. Women accept men having multiple partners, multiple wives, and it's okay. But a woman cannot do that. The society will go against her. So whether we are evolving as we think or not, that is still ingrained in us somehow, I think.
It seems like we're evolving in many other areas, but that part.
That's right. But you mentioned something again about testing. Testing is important for everyone. If you're having sex, it doesn't matter what kind, get tested at least once a year during your general physical exam. Because with HIV, people are positive. They may have like a viral syndrome that they would think, some people will call it the cold. That's what I hear a lot. And it clears away because it's a virus. It takes its toll and it clears away and it can lay dormant in the system for years. During that time, whoever is infected that didn't even know they're infected will just keep infecting others.
Yeah.
So testing is very important, and it doesn't matter who you are, get tested. If your primary care doctor is not adding that to your testing during your physical exam, ask for it, and they would add it, as well as other sexually transmitted diseases, because syphilis is another one.
Yes.
You know,
And there's sometimes I find some, people are offended when you ask, I'm married. And like I always say when I speak, the question as to whether or not you are sexually active and how many partners you have is not that I'm married. There is a numerical answer to that. That is the answer. Not I'm married is a status. So the providers have to be open. They have to keep their biases at home, and the implicit biases are so real. I was driving today and I realized, I was thinking, what's a perfect example for implicit bias? When you travel abroad and you see people driving on the left side, I immediately say, why are they driving on the wrong side of the street? Because I assume my side here is the right side. So when I go abroad, I'm like, they're driving on the wrong side. But that person, when they come to America, they're looking at us and saying, why are they driving on the wrong side? So it's a matter of perspective because both are right. So that is an implicit bias, because when you go, my way is the right way, and the person is going, no, my way, when you go into the room expecting the person to say they drive on the right side and they tell you they do all kind of things on the left side, you're looking at them like, oh my God, I didn't even know you can do that. But that's a biases. Being able to put it away is to look and say, oh, you drive on that side, that's interesting, tell me more. But a lot of providers are not doing that, and we have to get in the habit of just thinking what this person does is not my business. I'm not here to correct what they're doing, but give them the best information that they need to make the best decisions possible for them. If that's including PrEP, then PrEP is an option. And there are various forms of PrEP, so now we have the injectables, we have the orals, we have, depending on, the person, 211, there are different, options available. So we need to ask the right questions.
You're right. Asking the right questions also has to do with culture, because I can tell you all my years of practice, I asked the question, but I'll tell you, I was always uncomfortable so I started asking, like when we're doing history, when we're doing social history, I would ask, do you have sex with men, women, or both? Is the way I ended up asking it. And I always still felt uncomfortable because I feel like it's like an invasion of privacy. It's not something we were trained to ask people, and especially when it's older folks, people
Yes.
older than me. To me, it's kind of insultive, but I had to tell myself all the time that it's for their own good. I had to
Yeah.
come to the place where I had to, actually um, help myself that it is the right thing to do. It is the right question to ask because I need to know to ask it. So that is there also. And one thing that I did all through practice is when I'm checking labs, especially when I know, for physical exam, I would just tell the patient that I'm checking your CBC, BMP, I'm checking your blood sugar, your glucose, your kidneys, liver, cholesterol, and I'm checking sexually transmitted diseases like HIV, syphilis, gonorrhea, chlamydia. I just throw it out like that. I say it one by one in simple language. I would even throw in things like I'm going to check your urine because sometimes people would have urinary tract infection and they don't know and it can become a problem. So I throw it out like that. I don't ever see a patient who says, don't test me. So
Yeah,
that way, get the
I've had
testing.
patients. I'm sorry, excuse me. On the contrary, I've had patients, and I say, why? They say, I don't think I have it. I had somebody 2 weeks ago. I don't think I have it. I said, so then why don't you let me test? I don't want you to. I said, do you think you have high cholesterol? He says, no. I said, so why you want me to test it? I'm going to test your cholesterol. And then I said, do you think you have high blood pressure? Why you let her check your blood pressure? I think I got on his nerves so much. He said, just test it. Leave me alone. Just go ahead, add the test.
There was a time in the beginning of the HIV epidemic, or I call it pandemic, that we had to get um, signed approval
Yeah.
for us to test for HIV.
Yeah, I
As soon
remember.
as we moved away from that we didn't have to do that anymore, the technique I now use is what I said. And I didn't get anyone that would say, no, don't test it. So it may be a way to do it. Just throw it on with other labs. But Madam VP, Madam Lara Okonobi, that's our mama at NAPAC. Kindly unmute. I see your hand raised.
Yes, thank you, Doctor. Um, um, my comment is just to affirm what you said about it's cultural, and this is very important. Even I had difficulty with Pap smear when I got to this country. It was very uncomfortable, you know, to have a female doctor looking, where they needed to look. But it's important. So I think that explaining to people the consequence of this test, if it's not taken care of, the kind of breakdown that can come out of it would help that person to process, because it's important to understand why people feel invaded, people feel uncomfortable, people sometimes it's about even being naive about what it is. So you have to figure out a way to soften the message and to soften the reason why that person needed to submit to uh you know that kind of testing, because it's for their benefit. Everything you're explaining, it was shocking to me when children were being diagnosed with HIV. So that had not to do with sex. A lot of children were diagnosed with HIV, and it was disheartening for the parents that had to deal with that. You know, so and that at that time it started opening people's mind and understanding that okay, it's not always sexually transmitted. But this is a but I don't know if the parents or the carrier of those children, if they had traces of it. I don't know those details. But I'm just saying, if we want to get cure, if we want to get information out, we want this awareness, this outreach to be effective. We've got to figure out a way to deliver the message a stronger way. Thank you.
Thank you so much for your comments. I could not help but laugh, but it's um because you're so on point. I just realized something. Those babies that were diagnosed is because the mother had HIV and transmitted it to the baby. That's it. There's no other way. It's not like they have traces. You're either positive or negative with HIV. There's no
Well,
trace.
you're either positive or possible. I like to say, if you're not positive, you're possible.
I get you. If you are not positive, you still have the possibility of getting it if you don't do the right thing. Thank you.
Yeah.
So there's no in between, there's no trace. The mother was positive, or the mothers were positive, was why they, transmitted it to the baby. So
Not only was she positive, she was also had a viral load in which was not controlled, and that passed it on, because we know nowadays if the mothers take their medication accordingly, that they can become undetectable, and at that time they cannot transmit it to their babies.
That is 100% correct. We also know now today that if somebody is positive and they take their medications and their viral load is non-detectable, they're still positive, they still have HIV, but the HIV has been treated to where the viral load is
so low that
the
it's
threshold.
undetectable.
Yes, then they cannot transmit it. They do not transmit it to anyone. We know that too. Pastor Paul wrote that there was a time when test without consent was a factor of hindrance to prevention. That is true, because at that time you cannot just test anybody, they have to consent. And if they don't consent, you can't test them. That is so true. That was in those times, like 20 some years ago that you were talking about, when and then we still don't know too much about HIV. We know a lot now, and we're doing a lot better if people do the needful. PrEP is very important. PrEP is, the abbreviation for pre-exposure prophylaxis. And now we're advocating it for everyone and anyone who has sex. Because then if you have sex and you're using PrEP, then you will not get HIV, even if you are exposed to it. If your partner has it, you won't get it. Go ahead.
I would like to take it one step further and say I recommend PrEP even before someone is sexually active, because, and I use the concept, we don't start birth control on a young lady when she gets pregnant. We started before. So if we want to effectively prevent the infection before you even start having sex, that would be the time to get on PrEP. And the sooner we normalize that and have the conversation, and with that comparison with birth control, in the perfect world, my ideal would be when you get your birth control, you're also getting your PrEP, because we know that we're starting the birth control because you're going to be having condomless sex. So we should not only be protecting from pregnancy, but from STIs, because the same way you get pregnant is the same way you get the infection.
That is so true. And, a story came to my mind. I have to share. I diagnosed a lady once with chlamydia, and she said, Doc, so I was telling her that a partner needs to be treated, her husband needed to be treated. She was married. Otherwise, I would treat her and she will get reinfected if the husband is not treated. She said, no, no, no. She didn't get it from the husband. She got it from the toilet. I said, what do you mean from the toilet? She said, from the toilet seat. So trust me, it took a long time, a lot of education to educate that you cannot get chlamydia by sitting even on a public toilet seat. And she told me when she sat on the toilet seat, and that was why she got it. No, you cannot. It's not transmitted that way.
You have a lot of, what I see is, with that situation, I'll have a lot of partners, that's their explanation to give to their wife or girlfriend, that they got it from a bad bathroom, and they'll, sometimes they'll come in the office and they'll say, right, Dr. O, tell her. And I'm like, I cannot co-sign that one. Some things I may be able to write a note for work, and you really, one extra day, but this one I cannot co-sign. Tell her I got it from wearing my friend's underwear. One, I don't know why you're wearing your friend's underwear. Two, no, that is not how you got it. So we're going to treat everybody today, and then let's move on. Everybody keep themselves to only each other, and that's it. We're not going to, talk about where it came from. But there's still some very outrageous myths that are still out there, and the people believe it when they say, the toilet, or it's like a yeast infection but different. No, it's not like a yeast infection at all. It's totally different. But it is our job, as educators, to educate and empower. I found when I empower my patients and let them know this is something you deserve, and I want to give it to you, I want to help you to get this, it's a lot more, it's welcomed a lot more easily. The people are more receptive. My patients are more receptive to it.
Auntie Tower, you have your hand raised.
Good
Welcome,
evening, everyone.
Good
How you doing,
evening.
Dr. O?
Fine, thank you.
My question, I just want to know, because when I was working as a nurse in ICU, we had a patient, and this patient, when they tested him, had AIDS. But the wife didn't know. It's always coming. It's always doing something. And I felt so bad. I said, and they said, no, that is his privacy. You can't tell him. You can't tell her. You can't do this. So I want to know now that if you find somebody that has AIDS, full-blown AIDS, and maybe the wife, you can't tell the husband, or the husband, you can't tell the wife. At that time, that was many years ago, more than 20 years. So I just want to know what is the situation right now.
That's an excellent question. And, doctors are divided over this. I've been in forums where there are arguments one way or the other against each other. I honestly never participated. I just sit and listen. But some doctors feel that you still have to, protect the patient's HIPAA, right?
Yeah.
That you should not share their information, even with their spouse, regardless. And some doctors are like, no, it is wrong. This is something that affects life, that can kill the partner if they don't know, and that they need to be told that it is an ethical thing. So they argue back and forth, back and forth. So it's become a personal thing that it depends on how comfortable the provider feels, what they believe should be done. I can tell you what I did in practice. I've diagnosed people who I'll say, you need to tell your spouse, and you need to bring your spouse in so they can be tested, because I've had situations where a partner is positive and their partner was negative. They'll be positive, the partner was negative, and they had sex all the time. It's just that for whatever reason, they didn't infect that partner. So I tell them to tell, and I've had situations where when they come back, I say they didn't tell, so I cancel them. That you have to tell them, and I'll tell them why it's important. If you really love this person, you need to let them know. And some of the times they will bring their wives, or their husband, they will tell and then bring them for testing. Most times they ask me if I can help them do it. And 100% of the time I say yes. So we schedule an appointment, they bring their partners in for a regular visit. And, the three of us sit down there, and I break the news that, we tested your partner and found them to be HIV positive. How they got it, we don't know. We cannot tell, depending on their lifestyle. Say somebody that doesn't use drugs, that doesn't use IV drugs and all of that, and they got it, it could be sex, it could be IV drugs. whatever it could be, that it's important that we test the partner. And I'll explain to them that their partner being positive does not mean that they are positive, that the reason why their partner brought them is because they care and they want them tested. And we test and then take it from there. And like I said, I've seen instances where the partners were negative. And
That's
going
wonderful.
forward,
But this guy was crying, don't tell my wife, don't tell my wife. So the woman didn't know until they discharged him. I don't know whether the woman never knew.
I had a patient who her husband was positive. They weren't, she wasn't my patient at the time, and the husband refused to tell her and continued to be intimate with her. But they had the same primary care physician, a guy who kept telling the husband to tell the wife and know that he didn't. So when the wife came in for her visit, a visit with the physician told her, and she lost it. The physician got a blood work that day and tested her. Thank God she was negative, but that was the end of their marriage. And she changed physicians to me. That was how I got to know her and I got to meet her. She said she could not continue to go to the same place her husband was going to. She didn't want to have anything to do with him because he continued to be intimate with her, did not tell her for the duration of the time that it took for her to go in for a visit, and their primary care doctor then told her. So it varies how doctors handle that, but there's no standard. Dr. Ouwinga, is there a standard now for what doctors should do in that instant?
Well, the protocol that I know that we have is that, they have to go to the Department of Health and they'll have to disclose their names and they do the confidential notification of the partners. And the people in the Department of Health are pretty good, with trying to be very discreet and just saying someone you know. But I've also, as a provider, helped my patients to tell their partner. So I've had a patient that didn't want to tell the partner. So I said, bring your partner and then I'll just pretend for the first time I'm testing you and, you both do a physical and we'll take it from there, and they were comfortable with that. So they felt better being newly diagnosed with their support and, then they didn't know how to tell the person. So it was like, that was the best way we figured it out.
Wow. Wow. I never did that.
That's good.
I tell them.
Good.
I never did that.
You know what? Because if I can make the blow as easy as I can, whatever the patient wants, I'm going to help them to do it that way. Because we know in the very beginning, it's going to be a lot of transition. It's going to be hard. They're going to need a lot of support. So it's better if I can help them to do it together as opposed to this way, apart, then I'm going to go for it. And, sometimes that really does, that helps. They're crying together. Then, sometimes what I'll get is some couples will say, we don't even want to know where it maybe came from, who got it from who. We just, we have it and we're going to move on together. Of course, as I'm taking care of the person for years, whenever they get in an argument, they want to know, hey, you gave it to me, I gave it to me, they go back and forth. But initially, that's what they'll go back. And even when they're done with the argument, they go back to the fact that they said, okay, let's leave it alone. We both have it. We're going to take care of each other. So sometimes it ends up being, a good thing. I just tell people it's not the end, it's just a different road.
And that is true. That is very true. I commend you for, for that. Because at that point, you don't know who gave it to who or how they got it anyway. So it doesn't matter. What matters is, saving their lives, now getting them treated. and getting them to good health. HIV is now like a chronic illness, it's not something that will go to full-blown AIDS anymore if it's treated. And, the viruses are suppressed and people do fantastic. But if it's not diagnosed, then it's a different story. It still can kill people.
Yeah.
People can still get full-blown AIDS if they are not diagnosed on time. What HIV does is it affects not affects alone, it attacks the immune system. So imagine somebody not having good immune system. They subjected to anything and everything that they come into contact with. Even little things like ringworm
Or a common
becomes,
cold.
or common cold becomes blown out of proportion. I remembered, a patient that I saw with very, very low immune system. We measured the immune system with what we call the CD4 count. And this person came in with a CD4 count of 6, full-blown AIDS and a rash. The rash was I couldn't figure out what this rash is. It was all over the body, the face, everywhere. So I was so engrossed in knowing what this is that I wanted to touch the patient. This was like almost 20 years ago. And the patient said, "Stop, Dr. O, put on your gloves." It was the patient who told me to put on my gloves because I almost touched her. So I put on my gloves and just followed the rash, and something was common. They were large, like huge maps on the face, the back, the neck, everywhere, all over the body. But something was common to all of them. They had central clearing and serrated edges. And I'm like, whoa, ringworm. But it's because the immune system had been, devastated. And there's no ringworm medication I could have given to the patient that would have helped them. So I started treating the HIV and, then used some fungal medications and we cleared it. She wrote a book after that. I was in the book.
Mhm.
Yeah,
That's nice.
yeah. So it's important to diagnose and to treat. Without diagnosing, intervention cannot occur.
Mhm.
And until we get a cure, we have to continue treating to treat the virus to non-detectable.
Yeah. Any other comments? Anybody have any other comments?
Comments? Questions? Oh, I wanted to mention something else, the stigma. There's still a lot of stigma against HIV. I know a patient that I diagnosed and came in devastated because she told her mother, her own mother. And so she went to the house with her siblings, and the mother had plastic wares, plastic fork, spoon, and knife, and paper plates for her, while others were eating from regular plates and cutleries. The mother had disposables for her, would not let her eat with her plates or cutleries anymore. That was tough. And, I had to cancel her and just, encourage her. So there's still a lot of stigma against HIV, which is another reason why people are not getting tested or even coming in for pre-exposure prophylaxis because they don't want to be branded.
Yeah. I mean, that is very significant. Even for PrEP, people say, I had a patient who was on PrEP and the father saw the bottles and he was MSM and kicked him out the house, because he just assumed. And so it can be very sad. It can be very sad. But I think a lot of it comes from provider empowerment. as long as we need to start empowering the patients. Like today I had a young man who kept saying, I'm not worthy of love. He hasn't dated anyone since he was diagnosed. And I said, no, you are. I said, you are. I said, and you're doing yourself an injustice, and somebody is waiting to meet you. This is not the end. It's just a different road.
Yeah.
And I said, I encourage them to, look at some groups. You don't have to join them, but look at them, but whatever happened already happened. So start living your new life, so I'm hoping, I'm going to continue working on that with him, to get over, I said, I said, I don't allow people to talk badly about my patients, even if it's the patient themselves. So you have to stop.
Yeah.
And he was like, okay.
And I've had patients like that, and I'll tell you, in my experience, every single one of them are then found partners.
Good.
And interestingly enough, partners that were HIV negative,
Yeah.
who know their status,
Yeah.
and still decided. I have a lady who said, I can't do this. He's negative. He doesn't have HIV and he won't leave me alone. So I told her to bring him in. And he refused to use protection. But it was in the days that we didn't know that when you treated somebody to non-detectable, they're okay, they cannot infect their partner. It was in those days. So she brought him in and he said, I've loved her from high school. They've been exchanged and that he doesn't care. So it took a while, but I educated him to at least use condoms. We didn't have PrEP then also. Things have changed for the better so much.
Yes.
And well, every single one that I've said, no, I don't want to have relations with another person anymore because I don't want to infect them. They have met people that have fallen in love with them and they married or in significant relationships. So we just have to keep encouraging um, people like that. And again, now there's so much. There's PrEP, pre-exposure prophylaxis. Condom is still an option, and the positive person themselves, when taking their medications, being adherent, and get to non-detectable, they will not affect the partner. So we have so much more these days than we did before.
Yep.
So if there are no, okay, kindly unmute Zoom user. You have
Thank
the
you.
floor. You're
Thank you.
welcome.
Yes, I
So,
was just about to ask the question that back in the day,
mhm.
about 30, 31, 32 years back, it was mandated by certain states to actually have HIV testing done on couples before they
Before
got
marriage.
married,
Yeah.
before marriage. And so that was effective back then. Can anybody shed light on why that mandate was removed?
I don't know when it was removed. And I would assume, I don't know why it was, but I do remember at one point that was a requirement. Let me see if I can look
Yeah.
that up really quick.
I don't know when it was removed or why it was removed, but I would guess that it's because we have so much now options for people, like, if somebody is positive, they get treated to non-detectable, they won't spread it. But that should not be a reason, though, to remove such a mandate, because people who are just newly getting married, it would be great for them to know their status before they get into marriage. I know that even though it's not a mandate and it was never one in Maryland, I know many young couples that have gotten married. I know in my circle who test for HIV, syphilis, gonorrhea, chlamydia, trichomonas, and also they check for sickle cell. before they get married. They check to make sure that they are not carriers of the gene, that both of them are not, because then it predisposes them to having a child with sickle cell. Some churches also mandates it before they join couples, but I don't know why that was taken off.
Yeah, because I think if the mandate was still there, even though people are reluctant to get the PrEP because they don't want to shed any light on whether or not they have HIV, that mandate would have made people to be more compliant rather than democratizing healthcare, which is what this sounds like. Yes, to have your illness exposed and expose others is not a freedom that should necessarily be individualized.
I agree, 100%.
So doing a quick search overall.
No, before you please give us that resolve. I just wanted to mention this, that people on PrEP, people that we're encouraging to take pre-exposure prophylaxis, do not have HIV. In fact, before we start PrEP, we test to make sure they don't have HIV, because the medications that we use to prevent should not be used alone in somebody who is already positive. When somebody is positive, we have to use combination medications. What we use for pre-exposure prophylaxis are not combination. So PrEP is for those who are not positive, yes, is to protect them. So that even if they get exposed to HIV through sex, through IV drugs or whatever, they're protected. They won't catch it.
Thank you.
Yeah.
Thank you.
Yeah. So, Dr. O, go ahead.
Oh, a quick scan of the research just shows that it didn't seem to be a beneficial public health tactic overall. Most of the people who are at higher risk of acquisition weren't the people who were getting married. And it gave a false sense of security. So thinking that just because you screened negative when you got married, that maybe you were totally out of the clear for getting it later on, which we know is not true. So, and then people who just wanted to go over and above just would travel to other countries. So that also is what contributed to a lot of people doing weddings over, getaway weddings.
And that's true. They can go to any country to go do that. So Dr. Alu says, do we now have medication that can completely heal HIV patients?
We do not have medications that can heal. We have medications that can treat very well, but they will not cure, because a healing medication means that you have a start time and an end time, and once you're done, you no longer have that illness. But with HIV, once you stop the medications, the virus will be able to continue to replicate and potentially mutate and become harder to treat on the next round.
Yeah. Yeah. So in allopathic medicine, the kind of medicine that we practice, there is no cure for HIV yet. We only suppress the virus very well. So if there are no other questions or comments, kindly give us your, I'll ask the question. Medications to help not infect others, advertised, really works?
If you're referring to the ones on the market now, so we have Biktarvy, Bictegravir, FTC, and TAF, which is a good treatment. We have Dovato, which is dolutegravir and lamivudine, which is a 2-drug regimen. We have injectables, Cabenuva, which is good. So we're in a very good place of treatment right now. And all of these medications work very well.
No, treatment, prevention.
So prevention, we have, sorry. So
So
prevention.
she's asking, okay, let me ask the question again. She says medications to help not infect others that are advertised.
So yeah, so not
Do they really work? I think, Dr. Veronica, kindly unmute. Are you asking about the pre-exposure prophylaxis, the one that prevents you from getting the virus?
Yes, normally I'm one of those CNN people. I always see them interject and advertise all this. Oh, you can, people that have it can use it and not infect others.
Okay.
So I just wonder how possible that is. Would it not be advisable to always still tell people to use condom? Is what I wondered. Or do you can just have relationship with people without using condom, especially when they have HIV or other things, right? Thanks. The question.
I was right. So the medications
You
are
were right, yes.
the medications, the treatment medication. So the concept that we are referring to is U equals U, which is undetectable equals untransmittable. And what this means is that with a person living with HIV, if they take the medication on a regular basis and they get their viral load to undetectable, they cannot transmit it to another person. So this means that they can have condomless sex with another person and they cannot transmit it. That means that they can breastfeed their child and not pass it through breast milk. That means that they can have a delivery with a healthy baby that will not be HIV positive.
Okay.
Yeah.
Thank you, Dr. O and Dr. O.
You're welcome. You're welcome.
Dr. O Ogunleye is on the platform too.
Yeah.
We have all our Dr. O's on the platform tonight. So if you please give us your parting words, what you would like us to remember, take home message, basically, that would be fantastic.
My take home message would be, we all know that you cannot look at somebody and tell if they have, if they're infected with HIV. Treat everyone the same, screen everyone, and make sure to empower them. Use the PrEP as a tool of empowering. Should not be used as a shameful tool or a tool to condemn someone's activities. So use it as a tool to empower our patients and to help us get towards the goal of ending the HIV epidemic. Thank you.
Especially amongst Black women.
Especially, yes.
Thank you. And it's important that we take that advice to heart. Thank you. Thank you.